1 minute until showtime. Please take your seats. Nothing matters more than our kids. If we want them to succeed in school and in life, we have to ensure that they grow up healthy, physically and mentally. Today, we're facing an unprecedented mental health crisis. All of us know someone whose child has serious behavior challenges, is coping with depression or anxiety, or maybe even has attempted suicide. In the wake of COVID-19, our kids, including our youngest, are struggling like never before. We must move from crisis to prevention.
Instead of waiting for the candidates to set their own agendas, we wanted to get out front and together try to help shape those agendas.
Really the reason why we built the Vote for Our Kids Coalition is to make sure that that voice continues to be heard.
I think parents that thought their kids were doing well in school and have been sitting with them for the last 2 years trying to educate them at the kitchen table realize that perhaps their kids are struggling.
There was a mental health crisis for kids pre-COVID, pre-pandemic. The need has skyrocketed.
So we did a poll in Ohio. 7 in 10 of parents with young children under the age of 5 identified that they were deeply concerned about the mental health of their infants, toddlers, and preschoolers.
Even if young children don't completely understand what is happening because of the pandemic, they certainly can sense if their caregivers or their parents or their families are more stressed.
So when you think about mental health of babies, what we're really saying here is, are there the trusting relationships being established between parent and child?
There was a survey done in Clark County in 2021, and of the kids that completed the survey, 17% of the high school kids said they had made a plan to kill themselves.
Social media is not a friendly thing for kids. Oftentimes these kids are tethered to their social media platforms and their mobile devices. You know, we're just facing all kinds of challenges that in my 15 years of doing this, I never thought we'd face.
If we don't invest in mental health services, we are going to lose a generation. We're going to lose their personalities, their true, authentic selves.
Why is there this dramatic increase in behavioral health needs for youth? Kids are bullied on social media in ways that adults like us never had to experience because that didn't exist. The other piece is that Social media in some ways normalizes really poor coping skills like cutting.
Our response to the opiate epidemic was slow. And the problem with it being slow, a lot of people died in the process while we were correcting our system. Here we have an opportunity.
If we can't figure out how to prevent many of these conditions from happening at a younger age or at their first onset, we're going to continue to face these kids who are now in crisis. A lot of people are going to have to get their arms around this and point in the same direction.
It is going to take urgency and resources and a commitment and a focus.
The difficult part is we didn't get here overnight. So the solutions to address these challenges are going to take time and they're going to take sustained investments.
What I am very hopeful about is after many, many years of stigma around mental and behavioral health needs, people are talking about it openly.
Public-private partnerships are critical in addressing some of these issues, and if we don't invest in them and in their families now, we are not going to be competitive as a state going forward.
I am extremely worried that kids are not on the political agenda. We know that our children, their future is tied to the economy, the future growth, and our future workforce.
What we hope will come out of this event is that both gubernatorial candidates will have a deep understanding of what it is we need to do to help the children of our state thrive, and that they will be ready on day one to implement that agenda.
Ohio families and their kids deserve bold leadership from all of us. Every corner of the state is impacted by the mental health crisis, and it's not going away on its own. We have to act for the benefit of kids and families and for Ohio.
Good morning, everyone. Good morning. I love that. I love that. It's so great to be in this room full of over 800 people in Ohio who care about our children and our future. My name is Shannon Jones, and I'm the president and CEO of Groundwork Ohio, and I'm thrilled to be here today on behalf of our coalition, which includes Ohio Excels and Lisa Gray, its president, the Ohio Children's Hospital Association and its leader, Nicholas Shutka, the CEO and president, and on behalf of the entire coalition of over 100 organizations and individuals in the state, we welcome you to the Vote for Ohio Kids Leadership Forum, Moving from Crisis to Prevention. It's really an exciting day. You'll be hearing from Nick and Lisa soon, but we all know that nothing matters more to the future of our state, our nation, and frankly, our entire world than protecting the health and well-being of our children. We want to be sure that Ohio's next governor knows it too and does indeed make kids a priority. Now, we're all too familiar in this room with how the COVID-19 pandemic has exposed the fragility of our systems in both responding to and preventing a behavioral health crisis, and has exacerbated the healthcare challenges facing our youngest Ohioans. Because our babies, toddlers, preschoolers, and school-age children can't vote, we need to make sure that our leaders are prioritizing them so that they can have a successful future. It is up to us to be the voice of our children. So thank you for joining us to send this really strong message to Ohio's next governor, that kids must be at the top of the agenda. So as you're listening today, we hope you'll join us on social media. Please take lots of pictures. Tag us. Use the hashtag #VoteForOhioKids. If you're wearing your name tag or there's cards on the table where there's a QR code, please scan that QR code and join us in our effort. But we'll also be giving away an iPad Air at lunchtime. So make sure you sign up before the lunch is served and we'll announce the winner. If you're not into the QR codes, that's okay. There are those cards to be helpful. Be sure if you're here with a group and you're here with an organization, use our selfie and social media booth over there. There's some great signs, and again, use the hashtag #VoteForOhioKids. Next to the photo area over here, you'll see Ramsey Ford. Ramsey, give a wave, thank you. He's the principal with 4 Circle 6, and he's our graphic illustrator who will be hard at work while we're doing our work here, sketching what he hears. So he'll be capturing themes and quotes about how important children's mental health is. So in the back of the room, you'll see the exits, the doors that you came through. There's plenty of them, so in case of an emergency, please use the doors behind you. We just want to point them out and be mindful. Please, only those who are staffing the event should use the doors in the area behind the stage. Now back to why we're here today. As you can see from the programs on your table, it's a jam-packed agenda. Inside there, in addition to the agenda, are all the bios for all of our speakers, lots of great information, and also fact sheets in your packets that really share the story of what's happening in Ohio as it relates to our young children. You'll also hear more from our panelists today in the discussion, but there are some questions that each of our candidates answered in advance, and those appear in that program too, so be sure to check that out. Now, you all know this. Many of you were here with us 4 years ago. Vote for Ohio Kids is about making sure our next governor, regardless of political affiliation, follows the evidence, invests where it matters most, for our kids, for our taxpayers, and for Ohio's future. So we are a nonpartisan organization. We have our strict commitment to nonpartisanship that's printed for your information in the program as well, and we hope that you take a minute to review that. You're going to get the chance to hear from lots of folks today, in addition to our candidates for governor, including childhood mental health experts, some that you heard from earlier in our video, but a lot of parents too. Many of us are here on behalf of the families that we're serving, being their voice every day. And so we want to do what we can to help lift up their voices because they are the experts in their child's lives. So now I'm excited to introduce a short video featuring childhood mental health experts from all over the state and those voices we really want to hear from, our families. Enjoy.
What do we all care about most? Our children and families. But today, more than ever, they need us to hear them. They were struggling before COVID-19. But let's not kid ourselves. Their challenges, our challenges, have gotten bigger. The mental health crisis, the childcare crisis, the learning and workforce crisis are real. If Ohio is going to stay strong, we need to move from crisis to prevention.
Every day we have 20, 30, 40, 50 children presenting to our emergency rooms in mental health crisis. That's one health system. These families are terrified.
Imagine if you were your child and you know something's wrong, but you don't have the expertise to figure it out, and you try to get that help and you can't.
It's not only pills, it's not only contemplating suicide or cutting.
We've expanded our beds capacity significantly over the past 4 years, but it still hasn't been able to meet the need. We still have wait lists at times for many months.
Depression and suicidal thoughts are the #1 reason any kid is admitted to Dayton Children's.
Families are very resilient, but yet they're at their tipping point.
If you look at our outcomes for pediatric cancer, they are fantastic. It's now a chronic illness instead of a death sentence. The energy, the time, the resources, the personnel, when we compare that to what goes on in behavioral health, there is no comparison. But if you look at the behavioral health aspect, it affects so many more children.
We can often see the early markers in very young children, sometimes 2, 3, 4-year-olds. I guarantee you, we see those children come back at 7, 8, 9, 10, at 11, 12, 13, and they're bigger, and their behavior's more aggressive and more challenging.
We're just seeing that these children have a hard time building relationships, and it's not uncommon for a classroom, a group, to have maybe 4 or 5 of these little challenges.
Mental health issues are an equal opportunity offender. It is rampant across all ages, socioeconomic groups, and geographic locations.
But for those children in rural areas that have more acute issues, those kids are suffering, and oftentimes they don't have the access or the ability to get to a children's hospital.
This is the health crisis of our century. This is what's affecting children and adults more than anything else.
And it's not just mental health challenges that are overwhelming families. Affordable quality childcare doesn't exist or is out of reach. That's a problem for families and for employers who need workers on the job. Children's brains develop the fastest between birth to age 5. All the research shows that they benefit from high-quality early learning and childcare.
I think about childcare every day. The cost of childcare is almost like another mortgage payment.
If I was not an employee of a child care center, the cost would be $30,000 to $35,000 a year for 2 children.
It's very difficult to keep people in child care and keep them employed at a living wage.
You are not going to have focused employees doing their jobs and doing them at the best of their abilities if they're worried about where their children are.
There are things we can do to make things better for children, their families, and employers. But we need sustained investment. We need to commit to lifting up families so they and Ohio can thrive.
We're going to have to invest smarter. We're going to have to invest more consistently.
Ohio has a missed opportunity. We need to invest early. We need to invest early in the right sectors and over the long term.
A lot of promises are made election time. The year before, 2 years before election time, there's no follow through.
I believe a lot of it is political will. It's up to us to speak up for our children's issues and needs.
Our government, and particularly here in Ohio, we have made certain declarations, but yet there's no strategies, there's no supports. It's okay to make the declaration, but what are the next steps?
It's really important, I think, for policymakers and leaders to understand that we need data-driven policy that really focuses on improving access to care right now for kids.
Families want things that are offered to them to be actually attainable. I see a lot of programs that are offered, but it's like, who can get into them?
What families are saying is that money is not enough. Hear our voice about the change that needs to be made. Engage us in that change. Make a commitment to see that change through.
Morning.
Good morning.
Good morning, everybody. Good morning.
800 of you, welcome. I'm Nick Leshepka, President and CEO of the Ohio Children's Hospital Association, and more importantly, my wife and I are parents of 4 boys, and I can tell you that, ranging from 18 to 2 12-year-olds, we've had the mental health crisis affect our family too, and they've all been receiving treatment on and off since the pandemic happened, and this issue is very real. It is my job to, I'm going to get my job here, hang on one second. Let's celebrate that video and thank the team. We had really great statewide collaboration from not only our members, but Southeast Ohio, the child care arena as well. Talk about the real life issues that they're facing today. So let those voices stick with you as we hear from our gubernatorial candidates. I did want to take a quick moment. There's a lot of people here and a ton of work went into this. And I want to give a special thank you to Shannon's team at Groundwork Ohio. We're proud to partner with Groundwork and Ohio Excels. But if you see Shannon's team, please take a moment to thank them. They put countless hours in to make this event a success, and we're very grateful not only for the partnership, but the important mission we're all working together to accomplish. So it's my real pleasure and honor to introduce to you our panel and our first gubernatorial candidate. First I'd like to introduce Gloria Blevins, who is president and founder of the Ohio affiliate of the National Black Child Development Institute and the current chief executive officer of Early Childhood Options of University Circle. She'll be joined by Debbie Feldman. Debbie is the president and CEO of Dayton Children's Hospital, and our third panelist will be the Honorable Pat Tiberi, former congressman, president and CEO of the Ohio Business Roundtable. Come on up, folks. I'm going to go over just a couple ground rules we'll have for the day. Each panelist has a set of questions that they will ask both Governor DeWine and former Mayor Nan Whaley. No additional content is allowed. You can read in the program about our commitment, as Shannon mentioned, to nonpartisanship. As one of our colleagues, Sarah, told an elected official in Washington, we're radical centrists for kids in many cases, and that's what we are here today. Both candidates receive the same background information, and you can read their responses in your program. Both candidates also were given a choice as to how to set up the stage to their preference, and you'll see it set one way for the governor and another way for Mayor Whaley. So without further ado, it is my great honor and privilege to introduce our first gubernatorial candidate. He's had a long and distinguished career. You can read that in your program. But it's my great honor to welcome to the stage the 70th and current governor of the great state of Ohio, the Honorable Mike DeWine.
Thanks, Nick. Well, good morning, everyone. First of all, thank you. Thank you for being here. Thank you for inviting me, but most importantly, thank you for caring about kids. This is a diverse group, people with a lot of different backgrounds. But the one thing that we all have in common is we care about kids, so thank you for what you do. Throughout my career, if there's been one constant, that constant really, I think, has been about kids. Let me grab my notes here, excuse me. Many, many years ago, when I started my career, I was an assistant county prosecuting attorney. And the first job I had was to represent the Greene County Children's Services. And it was there that I saw, really for the first time in my life, just horrible tragedy of what adults can do to kids. When I was state senator, I had a little 7-year-old boy in our community who was killed on his way to school, killed by a driver who'd been drinking. Grandfather came to me, and as a result of that, we were able to pass the first really tough drunk driving law in the state history. In Congress, my focus remained on children. And let me just say that, my goal now as governor is the same goal the same goal that Fran and I have for our 8 children and our 26 grandchildren. And that is that they be happy, that they find something that they care very passionately about in life, that they get the training that they need to do that, and that they can get up every day and do that and be productive and to make a difference. They can live up to their full potential, and that is our goal for every child in the state. They live up to their God-given potential, that no matter where they're born, no matter who their parents are, where they grow up, that they have that ability. And that's what our focus is every day. In the United States Senate, I served 12 years in the Senate. Every year it came up and we fought for additional funding for our children's hospitals under the graduate medical education line item. I took some of my experience as county prosecuting attorney in regard to foster care and put them to work when I was in the U.S. Senate. I wrote the provision in law that says that in regard to family reunification, That's all well and good. That's what the goal is. But that the safety of the child always is paramount. That was not in the law before, and I wrote that. The Garrett Lee Smith Act played a major role in passing this. This was a bill that really, for the first time, provided money from the federal government in regard to dealing with the problem of suicide. I worked in a bipartisan way with Chris Dodd. We both had a focus on children's health. We were able to write a series of laws that, for the first time, really put an emphasis on making sure that drug companies, when they developed a drug, that they also tested that drug for children so that pediatricians, doctors knew what to prescribe, knew what the dosage would be. And that made a huge, huge difference. As governor, I'll have the opportunity, I'm sure, in the questions to talk about a number of things that we've done, more importantly, to talk about the things that we want to do. But just a couple highlights. Our first budget, when I became governor, we asked the General Assembly for the first time to set aside money specifically to go to our local schools throughout the state, over 600 school districts, significant dollars to be used for wellness, for behavioral health. In the two budgets we have set aside and the legislature passed, $1.2 billion that has gone back to our local schools so that they can focus on wellness, so they can focus on behavioral health. And many of them have done an absolutely amazing, amazing job. We put together a working group on foster care. They came up with 17 recommendations. These were experts in the field. These were family members who had experienced it. And they came back with 17 recommendations. We've either seen all of those come true or are in the process of making that happen, all 17 of those. Children's service money. We've doubled the amount of money going back to local children's services in the state. And it's still not enough, and we will do more. We set aside $84 million to go to our children, our great children's hospitals. And by the way, we are blessed in Ohio with some amazing children's hospitals. We set aside $84 million to go out to our children's hospitals to help them in the area of behavioral health. Over $1 billion we set aside for a number of other children's initiatives. And one of those initiatives is to improve, expand the home visiting program. When a mom has difficulties, maybe because of poverty, because of addiction, because of numerous things, that mom may need help early on in the pregnancy. And we've doubled that. And we intend to double it again in the budgets going forward. Imagination Library, something that my wife, Fran, has been very much involved in. When I became governor, when she became First Lady, it's only 13% of the kids 0 to 5 in the state that were actually receiving books. Many kids were not even eligible for this book a month. That number is now, we've gone from 13% to 50%. We now have over 355,000 books going out to 355,000 children every single month in the state to get them off to a good start. We have taken on the reform of Medicaid, a big task. We want Medicaid to focus on people, focus on kids who comprise, as you know, a huge, big percentage of the number of people on Medicaid. In that reform of Medicaid, as we center on people, as we center on children, one of the things that we have done is create what we call Ohio Rise. Medicaid experts believe that there's about 50,000 children in the state of Ohio who have significant behavioral health problems. And what is happening now, what has been happening, is that in some cases parents have to give up custody of those children to get help. And that's a horrible, horrible tragedy. In other cases, they get help, but the help is 2 states away. And in other cases, they have nowhere to go and don't know where to go. So through our managed care, we have set up, and we are in the process now of signing up families to be part of this. We are up to, I think, about 9,000 who have been signed up, and we're going to continue to go further, and we hope to sign up every one of those families. What happens is, under this program, it's through managed care, and we have someone who they can go to. There's a place, no matter where you live in the state of Ohio under this plan, where you can go for help, and they can get you into the help that you need. And I've talked to a number of families as I've traveled around the state, and they're very, very excited about this. Child care. When I became governor, only 40% of the child care providers in the state of Ohio were quality rated. We looked at that, and many people said, you're never going to get all of them quality rated. And we said, no, we're going to get every single one of them. And today, every single one is quality rated in the state of Ohio. So I know we'll get into many, many other things with the questions. I don't want to take any more time, but again, thank you for what you do. Thank you for caring. Thank you for giving me the chance to talk today and tell you not only about the things that we have done, but also to talk about the things that we're going to do in the future. Thank you very much.
Governor, I have the first question. The pandemic has exacerbated behavioral and mental health challenges facing Ohio's children and their families. The National Survey of Children's Health found that 1 in 4 children between the ages of 3 and 17 reported having a mental, emotional, developmental, or behavioral problem in the 2019-2020 year. Our babies and toddlers are also impacted by this crisis, with Ohio polling finding that 7 out of 10 parents of 0 to 5-year-olds were concerned about the mental health of their children. If re-elected governor, what steps would you take to both prevent and mitigate the impacts of the mental health crisis facing our youngest Ohioans and their families?
Well, thank you very much for the question. You know, I have heard from you and all our children's hospitals about the number of children that they are seeing, and they're really overwhelmed what you're seeing every single day of children with mental health problems. Another interesting fact and scary fact, 3/4 of the mental illness onset occurs in 3/4 of people who end up with that before the age of 25. So again, it tells us the importance of engaging and making sure that there are assets out there to deal with that. Let me just pull back for a moment, because I want to talk a little bit about what our goal is, not just for children, but for everyone in regard to behavioral health. Our big goals are to make sure that every child, every adult every child and every adult in the state has access. 2, we intend in this next term, if I'm fortunate to have the next term, to really make Ohio the #1 state in research. 3rd, we want to make sure that we're #1 in patient care. This is something that I believe that we can, in fact, do. These are big, big goals, but we need to think big. We need to say that we're going to be #1 of all the states in the union in this area. I talked for a moment ago about Ohio Rise, and Ohio Rise, again, is, I believe, the help that parents who have children with behavioral health challenges, serious challenges, it's the help that they need. And for years, I've traveled around the state, I've talked to parents. It's time we gave them the help. We're doing this through our Medicaid reform, and it will make a huge difference. Long before, I think it was really understood how many of our children were having challenges in regard to mental health. Right after I became governor, when we presented our budget to the legislature, it did something that had never been done before. We set aside money for wellness, and we gave schools the flexibility how to spend it. Some literally have set up clinics in their schools with this money and other money they put together. But many of them have set up their programs of counseling, and they have reached out into the community to take this money and to get the resources they need to deal with behavioral health with the children in this school. I think for us to really understand this, we have to go back 60 years. 60 years ago, 1963, John Kennedy signed the Community Mental Health Act. And in that act, there was really two things, two goals. And one goal was to free from our mental hospitals, stop warehousing people, let them go back into the community. And the second goal was to make sure in that community that there was, no matter where you live, that there was help if you or some member of your family had a behavioral health challenge. I wrote a quote down from Kennedy at that time, and he said, "The goal of this is to have the cold mercy of custodial care be replaced by the open warmth of the community." Great goal. We never have achieved it. And Ohio's not alone. We've not achieved it. Our goal should be to make sure that there is access to every Ohioan who needs help, every family who needs help, that there's access in the community. And we have started that, and we have started down that path. We have a ways to go, but we have started down that path for adults as well as for children. We also have the goal of research, and we will be presenting to the General Assembly in the next several months a proposal in regard to research. Why is it important that Ohio do research in this area? My experience in life has been that when there is research, when there is brought together the experts in a field, when a state or a hospital becomes known as the place to go for research in a particular area, what happens is like a magnet, and experts are drawn to that hospital, to that state. So we need to do the research because not enough research has been done in this area. But we also need to do it and be number one in the area of research because it gives Ohio a competitive advantage and makes it much more likely that our citizens get the help that they need as we draw people, bright people, researchers, practitioners, as we draw them to the state of Ohio. Third is workforce. I don't have to tell any of you the problems of workforce. It's interesting. If you look at the last decade, the workforce is up. I'm told it's up 200%. Challenge is that the need is up 400%. And so we continue to fall farther behind in this area. We have started we have a plan that we are implementing. And I won't don't have the time to explain everything about it, but we're paying now for internships for people who work in that field. For a social worker, young person who's looking at, I have to now do the practical work, I have to go out and do that, I can't get paid for that. We're now paying for that. That's our plan to start doing that. We're also paying for scholarships. We're going to do other things to try to incentivize people to get into this field. People who normally would want to get into it, but because of cost, because of lack of money, because of time, maybe choose another route. We understand that workforce in this area from all different levels when we're dealing with behavioral health is absolutely essential. So thank you very much.
Thank you for that, Governor. I have our next question. Even before the pandemic, many Ohio children were exposed to or experiencing trauma or adverse childhood experiences, which we all know as ACEs, which can include child abuse and neglect, parental incarceration, and living in a household with someone who has a substance use disorder or mental health problem, which can lead to risk of poor health outcomes later in life. If re-elected governor, what steps would you take to build safe, stable, and nurturing environments for Ohio children? And how would you prevent and mitigate the impacts of children's exposure to ACEs?
Well, thank you for the question. This is certainly a problem. There have been studies done in Ohio that show that the ACEs is a huge problem for children. And as you point out, there's many ways that this kind of trauma can occur. It can be addiction to somebody in the family that they're living with. It could be mental health challenges, could be extreme poverty and all the other things that may go with poverty, and there's many other reasons. Our goals have to be to do whatever we can to reduce the incidence. But second, when we cannot stop them from occurring, to do everything that we can for that child to mitigate this and to help the child deal with that. I wrote down a few things that we have done. And again, we're not only going to continue to do these, but we're going to expand them. The home visiting programs. Home visiting programs relate to this because it helps a mom and a dad become better parents. And by being better parents, maybe they're able to deal with some of their own challenges and not inflict the adverse childhood experiences on the children. We have doubled that program. We will double it again in our next administration. Foster care. Again, we've doubled the amount of money going to our local children's service agencies, and it's still not enough, and we have to do more. Again, we put together a group of people to look at foster care and see how we could help. We know that many of our children are in foster care and something's happened in the family and that child has dealt with 3, 4, 5, 6 adverse childhood experiences. And we know that is very difficult for that child. And so we looked at the foster care system. We came up with 17 things to change. We're in the process of doing that. Some we've already done. And let me just say, foster care is always a work in progress. And we have to listen. And we try to do that. We listen to the foster parents. We listen to juvenile judges. We listen to other people who are in the field and who are dealing with this every single day. But we still have a ways to go. We created something when I was Attorney General that we have continued and we continue to expand. We call it Ohio Start. And it came from what we found And one of the things that we found, of course, is that challenges that children face many times come from the parents being drug addicts, either one parent or in some cases two. And the Ohio START program took a different approach, really. And what we did is we surge in resources, not just for the child, but also for the parent. And the whole goal is to see family reunification when that's possible. But you can't just help the child. You have to, at the same time, help the parent. We've had good success with that. Doesn't always work, but we've had very good success. We've increased the numbers of cases and children who actually have been able to go back to the families, and the families have been able to thrive. We will continue to expand that. Poverty and other things connected with poverty can be part of challenges. And one of the things in the long run we have to do is really focus to make sure that every child, and this is my goal, that every child when they graduate from high school will be on a pathway, whether that's a college pathway or whether that's a pathway to the trades, whether that's a pathway to welding, all kinds of different things. We have dramatically increased the focus on our two-year community colleges, but we've also dramatically increased the focus we have in regard to our career centers. I've traveled to a lot of our career centers, and we have something really magical happening in those career centers today. And what we're seeing happen is that kids who maybe didn't have a pathway, but decided, I want to try the career center, and they've gone to the career center, and for the first time, they love what they're doing. And you see it in these kids' eyes, and you listen to them. And so, again, the worst thing that can happen is for a child to graduate from high school and have no pathway, don't know where they're going. And so to give them a pathway, even if they change their pathway, my wife Fran will tell you I've changed my pathway, a whole bunch of times, and even did right after we got married. So there's nothing wrong with changing pathway, but have a pathway. And by emphasizing this, we will give these kids the tools that they need to get, in some cases, to get out of poverty, some cases to do other things, but allowing them to live their own dream. Whatever that dream is, allow them to have their dream. That has to be our goal, and we're making significant progress in this area. And I truly believe that their children will have fewer adverse childhood experiences, fewer ACEs, if that child, if the parent loves what they do, if they're successful, if they have a job. And so again, in the long run, I think that will make a big difference as well. We have a program called Tech Cred, where we take a 30-year-old or 40-year-old who maybe is in a job, but it's a dead-end job, or maybe to keep that job or to make more money, they have to have additional credential or learn something. And what we've said to employers is, if you put that person in a course and they get an industry-recognized credential, we, the state, will pay for that. And we've had now close to 50,000 Ohioans who've taken advantage of that. And I just do believe this relates to your question, because again, while it doesn't guarantee anything, it does mean that the family will have more resources, more money, more help, and that wage earner will feel better about themselves and about what they're doing. So those are a few things that I think will make a difference. We're doing them. We're going to continue to do them. We're going to expand them. I think that, again, will make a big difference.
Thank you.
Ohio's children are behind in academic readiness. and there is limited access to quality early learning and early intervention in Ohio. In the 2021-2022 school year, more than half of Ohio's children, 62.1%, were not demonstrating kindergarten readiness, with alarming disparities in children experiencing economic disadvantage. It is vital that Ohio's children are ready and prepared to meet the demands of our state's evolving economy as they grow into the future of our workforce. Providing high quality, accessible early learning sets them up for success later in life and yields a substantial return on public investment. At the same time, many of Ohio's children lack access to quality early learning programs, including more than 350,000 children from households from low-income families. As governor, what actions would you take to promote equitable access to quality early learning opportunities that prepare our children for life and success as our state's future workforce and future leaders?
Well, thank you for the question. This is a case where what's best for the child is also best for the state and best for the country and the best for the rest of us. We have a common goal, common things coming together. Early childhood education, early childhood development is absolutely the most important thing we can do. If we have limited resources, taking the resources that we have and investing them early is really the most bang for the buck. It's also the right thing to do. The first goal has to be to make sure that child, when they go to kindergarten, they're up to the starting line. And there's a lot of things that we are doing now, and frankly, we will expand these programs if I'm fortunate enough to be elected by you as governor again. Prenatal care. We've dramatically increased prenatal care. Postnatal care. We've dramatically increased that. We've done the home visiting programs, and we have doubled that. And as I said, we will double that again as we move forward. Things like Franz Dolly Parton Imagination Library. Again, it may seem like a small thing, but putting books in a household, think about it. If the child is signed up at the time of birth, they're going to get 60 books going into that household addressed to that child by the time they turn 5 years of age. So all of those things matter. Quality child care matters. The studies for many, many years have shown that if it's high quality child care, it makes a fundamental difference in the child and how that child, what position that child will be by the time they start kindergarten. If it's not high quality, the studies indicate doesn't really do it. So we have put a premium on high quality child care. Now, I'll read you some of the statistics. We're about at 40% that were being rated. Now we're at 100% that are being rated. Now we have to continue to try to improve all of those, or those that do not have the top rating. I know that there's been some people who've been critical about what the criteria is to rate them. We're open. We're open to discuss that. We're open to evidence that shows other things to rate them. But we have to rate them. We have to do that so that people know what we're dealing with. We have to have goals that we aspire to. When I came into office, less than 40% of child care providers receiving public funding were quality rated. Within 18 months, all publicly funded child care providers were star rated, ensuring that our youngest learners have access to quality learning. We've also expanded eligibility for publicly funded child care for more families. We have to do that. Today, families up to 142% of the federal poverty level can receive child care funding. That's up from 130% when I came into office. I plan to increase this to at least 150 percent in our next budget, and we would certainly hope to go even higher than that. Pat, there's again a focus on early childhood education, a focus on an understanding of what teachers, once they start school, what teachers have told me for many, many years. We have a son who is a teacher, a daughter-in-law who is a teacher. And what teachers have told me for many years is, look, I can teach, these kids could learn. The problem is it's not what happens in the classroom, it's what happens outside the classroom, or what doesn't happen outside the classroom. So all the things that we know that work. We have some people here from boys club, girls clubs. You know, these work. We've invested state dollars into boys clubs, girls clubs. Why? Because it works. All of these things matter. We're doing a lot more than we've done before. We need to do even more as we go forward. And again, it's interesting that the business community is starting to really get this, and they're starting to understand it. And when I go into career centers and I meet with the teacher and I talk to the students and see their enthusiasm, but I also talk to the business people. And the business people, there is now something that 15 years ago we didn't really see, and that is a very, very close relationship between the teacher, whether it is a teacher of welding, whether it is a teacher of culinary arts, it doesn't matter, and business community. And these kids are now starting to have jobs when they are seniors in school, and all of that matters. So it's, you know, from prenatal all the way through. It makes a difference, and we just have to continue to focus on these kids. I'll conclude with this. When I gave my first State of the State speech to the legislature, I looked at them and I said, I'm going to ask you to do things where you're not going to see the results for years. Now that's hard to do if you're running for office every 2 years or every 4 years. But I said, look, I'm going to ask you to plant these trees. I'm going to ask you to invest in these kids. And we may not see the results really for 20 years or 30 years. But we've been able to do this. And we put more money in kids than have ever been before. And that doesn't mean it's enough, and it's not enough, and we have more to do. And we have to look at these programs and continue to judge what works, what does not work. But invest in our children is the best recipe for a great Ohio.
Thank you. So in 2020, suicide became the second leading cause of death amongst individuals 10 to 14 years old, and the third leading cause of death among individuals 15 to 24 years old. In 2021, Ohio's children's hospitals admitted youth to one of our inpatient behavioral health beds 10,550 times. We provided over 560,000 behavioral health outpatient services in the same year. Yet it was not enough to meet the needs of Ohio's families. Kids routinely sit in emergency departments or back at home waiting for desperately sought care. If re-elected governor, how would you help families receive timely support and increase access to care for both preventative and crisis services?
It is a huge problem. And when you listen to your numbers and I talk to you or to other children's hospitals across the state, it's just absolutely staggering. You know, we've done some things. We provided $84 million to our children's hospitals, and that's a beginning. It's not the end. $1.2 billion for student wellness. Again, it's the beginning, not the end. We published Ohio's first suicide protection plan in partnership with the Ohio Suicide Prevention Foundation. Beat the stigma. You may have seen that on TV. Part of this is getting people to understand, whether it's a child or an adult, that we have to treat a behavioral health problem like we treat cancer or we treat any other problem. It's a medical problem, and we have to deal with it that way. And again, getting people's minds around that so that they understand that. We partnered with Nationwide in this Beat the Stigma campaign. I think it makes a difference. Getting kids back in school, you know, it was important, frankly, during the pandemic that we get kids back in school. And let me just be quite candid. What we were seeing once we had the vaccine, once we were able for anybody to get the vaccine, we looked at this and said, okay, what schools are back? Because we gave them the ability. It was up to it was local. Local school made the decision when do they go back in school. And frankly, most of our rural schools were back in. But it became apparent to me at some point that our urban schools it's going to be a long time before the urban schools went back in. And I made them a deal. I said, look, if you will go back in by March 1st of that year, which was, you know, I think 6 weeks away, something like that. If you go back in by March 1st, here's the deal. We'll come in now, and we will put teachers, your teachers, and other teachers across the state, because they're so important, to get kids in school, we'll put them at the head of the line, and we'll let them get the vaccine. And we had great success with that, and we were able to get our urban schools back in, I think, almost every single one of them. I asked them to sign a contract, and they signed the contract. And I think almost every single one of them, a couple exceptions that were a few days late, but almost all of them were back in. We had every kid back in school. Again, that was something that we felt that was very, very important to do and get these kids back in. We have to continue to invest in this. We have to continue to help our hospitals, particularly our children's hospitals, but we also have to build out, as we are doing, we have to really continue to build out a system in the state. And getting back to what John Kennedy said 60 years ago, it needs to be accessible for everyone. And that certainly includes children. I cannot think of anything more, and I've talked to parents who've experienced this, but I can't think of anything much worse than to have a child who has a challenge. You know that child has that problem. They need help. They have this medical condition, and you cannot get them in any place. And it's a month wait, or 2 months, or 4 months, or on the other hand, you can't figure out where to take them, and no one can help you. So building this system, we're a very local state, and my experience in life has been that if you want something done, it has to be done locally. And our job is to help grow that locally, working with our children's hospitals, working with our other professionals. We need more people in the field, as I talked about a moment ago, and we need navigators, we need people who can guide and build this system up from the local level. We have doubled the mobile response stabilization services, just as one example, and we will continue to grow that. We're not where we need to be, but we're moving, and we're going to continue to move.
Thank you. Governor, unfortunately, vast disparities exist in young children's access to and quality of the health care they receive, and the educational opportunities available to them with outcomes predictable by race, geographical location, family income, and a myriad of social and demographic factors. As governor, how would you promote equity and ensure that every young child in Ohio has the opportunity to achieve their full potential?
Well, that is our goal, and I think you've stated it absolutely correctly, that this is what has to be our goal. Every child in Ohio deserves the chance to succeed. I don't care where they live, I don't care who their parents are, whether Appalachia, whether in the inner city, whether the suburb, it doesn't matter. They all have that. And we have an obligation, we as adults, we in government, we at the state level the local level, we have an obligation to do everything we can to make sure they get that opportunity and they get that chance. They deserve a chance to get a good paying job, to raise a family themselves comfortably, to be secure in their future, to live their whatever their dream is and whatever their version is of the American dream. They have every right to do that. The first thing I did after I was sworn in at midnight, something I did within the first 5 minutes, I signed an executive order to create the Governor's Children's Initiative. And I charged them to look at the science and programs and interventions that have proven to work and to focus on them. So from the very beginning of my term, all of our efforts have really been focused on addressing disparities, and there are disparities. We saw that during the pandemic. What we already knew about disparities in healthcare were driven home even more during the pandemic. Here's an example. We know about lead poisoning. We know that there's absolutely no safe level of lead. Yet every single year, thousands of Ohio children test positive for unsafe levels of lead. And there are also thousands who are not being tested, who have been exposed to lead. We have to do more in this area. And this, again, is a question of parity. It's a question of equality. We dramatically increased the funding for lead abatement programs. In my next budget, we intend to double what we spent in the last budget. We need to continue to ramp that up. We need to continue to work with the local communities. So it is doing what we can and from a remedial point of view so that kids don't grow up in houses with lead. It's also, when that has already happened, to do whatever we can to work and to help that child. We also see a great inequity in regard to broadband, and we're working on that. And I think that when we discuss it, and sometimes when it's discussed in the media, we naturally think, oh, that's rural. That's a rural problem. Well, it is a rural problem, but it's also a problem in some of our cities. We've seen. We've done some work, Lieutenant Governor and I have, in regard to East Cleveland, right in the urban area. And they were not getting the broadband, and the people there did not have access to that. It also spills over, and it matters not only for education, for communication, for work, but it also matters in regard to one of the things that we found during the pandemic, and there were some good things that occurred during the pandemic, and one is telehealth. We found that it actually works. In many cases, it is great. And so, again, with the expansion of broadband, we can make sure that more people have access to telehealth. People who would not maybe get to talk to a specialist, maybe not to get the treatment that they needed. And the more we can expand that, the better is as well. We're doing broadband again in some of our schools. I mentioned East Cleveland as one example. The other end of this would be in rural Ohio. In a school called Switzerland of Ohio, Ohio's largest geographic school district, we provide funding to create telehealth facilities in each of their school buildings. Through high-speed internet provided by Ornet, we've empowered them to serve more students, reduce unnecessary travel times between school buildings, improve care for students, and again, we're also seeing the use of telehealth, and we're seeing telehealth actually being utilized in schools as well. Other things that we've done, we've invested in evidence-based, as I said, talked about a moment ago, home visiting. We've extended postpartum coverage so moms can access care now for up to 1 year after their baby is born. We've changed that. We've created new programs to incentivize pediatric providers to meet children where they are. We've expanded access to quality child care, We've spent more than $1.2 billion, again, for mental and physical health care services right in our schools. So we have to constantly, I think, one of the guiding principles should be, as we focus on children, is equity, equality, and making sure that we're identifying kids who are further behind, maybe who do not have certain things, whether their family having broadband, whatever that is, and make sure that we do things to compensate in regard to kids. We see it, and I'll just conclude with this, we see it in our colleges. And one of the things that I've worked with our 14 college presidents, and they're all working on this, but we have kids who are smart, who can do college work, but because of some disparity in their background and their education, they need extra help in college. And what we've found is when they get that extra help, they make it, and their life has changed, and they can move forward. So again, we see this all throughout education, and we see it all throughout healthcare, and we have to be mindful of it, and we have to focus on it. Thank you.
Thank you.
An integrated child-serving prevention, health, and education workforce is the foundation of support for children and their families, and it contributes to building a healthier, more productive, and economically vibrant state. However, the pandemic has exposed the lack of workplace supports for key workers and created a workforce shortage across many child-serving systems. As governor, how would you address the incredible challenges that our child-serving workforce faces and ensure that those who are caring for and educating Ohio's children are set up for success?
Well, let me start with some things that we have done to kind of triage, and we saw our child care facilities really hit, of course, during the pandemic, and one of our goals was to keep as many of them, frankly, alive as we could, so they could survive the pandemic. Throughout my press conferences during the pandemic, I often highlighted the incredible work that Ohio's child care professionals do on a daily basis. We invested hundreds of millions of dollars to support Ohio's child care providers throughout the pandemic and to deal with the current workforce challenges they're facing so that they could keep those people there. We created a hero pay program that provided child care educators with quarterly retention payments for each quarter that they continued to work in the child care industry. So far, we've handed out 3 rounds of hero pay stipends. We also created child care stabilization grants, allowing child care providers to apply for funding to cover their pandemic expenses, including providing recruitment and retention bonuses for workers. Those bonuses were and are important. These grants are real money for our child care providers. We've issued 2 rounds of these grants so far, and the 3rd round just recently opened up so that they can apply. In this most recent round of stabilization grants, providers can receive a $50,000 base payment plus an additional $1,100 per child. Ohio's in-demand job list helps bring awareness to career paths most in need of workers. It helps people choose a new job or a new education program because they can see it will result in a stable career. We expanded this to include what we called critical occupations, which includes child care workers, mental health workers, and healthcare workers. By doing this, by making this change, we made more of these jobs eligible for federal workforce dollars, for training programs, and for scholarships. So we opened it up to those individuals. It also shines a light on these career opportunities to, we hope, attract more young people and job seekers into these critical fields. We're also investing in programs like Teach Ohio, Power Ohio. Power Ohio provides early childhood educators that pursue and attain additional education with wage supplements up to an additional $5,000 a year. Teach Ohio covers fees for early childhood educators to receive their Child Development Associate's credentials and provides a bonus wage increase for a period of time while they remain in the classroom. We've also made strides, I think, to further professionalize our many child-serving sectors. We created an infant mental health credential to equip early childhood professionals with necessary skills to identify, intervene, and treat infant trauma and the needs of their families. I think part of what we have to do as we look at this from going forward and we look at the long run, we have to provide that someone who goes into the child care field and wants to advance, that we give them more opportunities free of charge to get additional training that they need. I mentioned earlier that we're doing it in manufacturing and other areas like that, where someone can get an additional credential. They can pancake that up and continue to move forward. I think to attract people into the child care area, we want to be able to promise them that if they do a good job and that we will make other training available for them and that there's areas for them to advance. What we don't want to do is to hire, tell people, look, you come in at this level and you're never going to advance or you're never going to move. So part of it is to professionalize it more and to, realize that these people are taking care of the most precious thing in our lives, and that is our kids. So I think, Pat, I think there are, as I said, a number of things that we can do in this area. Let me just, if I could, I realize that is the last question. We put out a week or so ago a vision and a blueprint of things that we are going to ask the legislature to do, in addition to things I've talked about. We call it Bold Beginnings. And this is, you can get a copy of that, you can read it, and it's at boldbeginning.ohio.gov. That's boldbeginning.ohio.gov. And again, this covers a number of things that I've not talked about today. Some I have talked about, but it's some of the vision that we have as we move forward. So, thank you.
Thank you
very much.
Thank you.
Governor, thank you for your comments and thoughtfulness. We very much value your leadership. And I want to thank our three panelists, Debbie, Gloria, and Pat. We're gonna take a quick audible here so you all can exit the stage. Thank you again.
Thanks.
Please join me again for thanking the governor for being with us this morning. Okay, those three get a quick break, but we're gonna make a little audible here and forego our break. Of course, if you do need to use the restrooms or refresh your coffee, please feel free to do so. Part of what we heard there this morning is the incredible coalition that is Vote for Ohio Kids. It includes advocates, it includes caregivers, the daycares, the providers, but really what's really an important component of this partnership is the business community. And without their support, both from a leadership standpoint and financially, it'd be really difficult to really carry this consensus agenda forward. And it's my great honor and pleasure to introduce our good friend, Dave Mellon. Dave is the regional president in Dayton for PNC Bank. They've been a charter sponsor of ours since 4 years ago and have been tremendously engaged with us throughout the last 4 years since we were here again. So PNC is the platinum sponsor for the coalition. Please welcome to the stage Dave Mellon.
And a big thank you for all of you that decided that it was more important to hear from me than go to the restroom. So nothing worse than the restroom or the bar. So thank you, Nick. And on behalf of the tens of thousands of PNC employees across the state of Ohio, some of them are here with me today in the audience. We appreciate the opportunity to be here with you this morning. My colleague, Mary Auk, who's the regional president here in Columbus, had another commitment, so she sends her regards. But Warren Weber from the Cincinnati market, the regional president there, joins me along with a lot of others. As leaders at PNC, one of our key responsibilities is to ensure the organization does good while others are doing well. And financial performance is critical, but giving back to the communities where we live and work is also paramount. Our success is proportionate to the success of those we serve in each of our communities. That's why we are consistently seeking opportunities to invest our resources where they can have the greatest impact. We know parents, caregivers, and employers agree that the need for equitable, affordable, and accessible child care has never been greater than today. Affordable and accessible, high-quality child care and early learning programs are foundational to the children's education and future and their parents' ability to work and support their families, knowing their children are safe and cared for. Throughout the pandemic, child care centers and early childhood educators have worked tirelessly to offer families of all backgrounds and means an opportunity for quality, equitable child care. Child care centers must be able to staff appropriately to safely care for children and offer a reliable, enriching environment that benefits both children and parents. We know that education is a powerful means for economic and social mobility, and children who participate in high-quality preschool are far more likely to achieve and to contribute to society in their adult lives. Hopefully, it's easy to see why PNC is so firmly committed to early childhood education. Investing and advocating for high-quality early education is a logical extension of our commitment as a national Main Street bank to support the communities where we live and work. In 2004, PNC launched Grow Up Great, focusing our philanthropic support on early childhood education to make the biggest impact, helping to prepare children from birth to age 5 for success in school and life. PNC Grow Up Great is now a $500 million multi-year bilingual initiative. The program supports early childhood education to help ensure that all children and participate those who are underserved are ready for kindergarten, setting a solid foundation for their education as they grow. To date, more than 8 million children across the country have benefited from PNC's local grants and educational programming. I want to share a few reasons of why we support these initiatives. First, it can narrow the achievement gap. We know gaps in knowledge and ability between children with little to no access to necessary resources and their more advantaged peers start to appear long before kindergarten. And those gaps tend to persist throughout life. These gaps are difficult and costly to close, which is why PNC cultivates a proactive approach to cognitive and social skill development through its support of quality early childhood programs. It's more effective and more efficient than trying to close the gap later. The impact of high-quality early childhood education goes beyond the cognitive and social benefits for children. There is also an impact on parents' ability for employment and their earnings. When children have access to high-quality child care, of which high-quality early education is a critical component, parents can go to work knowing their children are in a safe and nurturing environment. High costs and lack of childcare is forcing parents to make a difficult choice. Either work and spend a high percentage of their income on childcare or give up work to stay home and provide care themselves. Mothers are often disproportionately affected by the lack of options for high quality learning as well. For example, throughout the COVID pandemic, Mothers were more likely to stay home and provide child care. As a result, today's women's labor workforce participation rate stands at 57.1%, the lowest it's been since October of 1998. The ability to return to work without worrying about the costs and quality of child care allows women to advance their careers. Economic analysis shows that as women's labor force increases, so does the U.S. gross domestic product. Therefore, investing in early child care and education will spur stronger maternal workforce participation, and closing the gender employment gap will boost the productivity and catalyze a thriving economy. The investment in early childhood education generates an economic return in the form of long-term family and societal cost savings by contributing to improvements in child care and well-being, as well as decreasing spending on social services. With investment in high-quality early childhood education generating a 13% return on investment, this initiative is one of the best uses of our community investment dollars. Beyond the reasons I've already cited, investing in high-quality early childhood education generates community benefits that help businesses, communities, and the people who live in them. Those investment dollars also ultimately improve property values, provide cost savings for municipal school systems for K through 12 education, reduce crime, and reliance on government assistance, which helps entire communities thrive. The High Scope Perry School Project, a landmark long-term study of the effects of high-quality early care and education on low-income 3 to 4-year-olds, showed that children who attend high-quality preschool programs had 34% higher basic achievement at age 14. Additionally, 17% more graduated high school, 14% more were employed at age 40, and by the age of 40, their annual income was 20% higher than similar employees who did not participate in early child education. Children who attend high-quality early learning programs have higher graduation rates, employment, and higher income. This can also mean better physical and mental health, increased civic engagement, and a healthier society overall. Supporting mental health is crucial. September is National Suicide Prevention and Awareness Month. A national crisis has been hiding in plain sight and is finally getting more attention, and it's about time. We want to thank and appreciate Nationwide Children's Hospital here in Columbus and Dayton Children's Hospital in particular for their work in the On Our Sleeves campaign, part of a national movement to break stigmas around the children's mental health. The On Our Sleeves mission is to provide free mental health education resources to every community in America to educate families and empower advocates. The program also provides access to services by connecting families to trusted local resources. I'm sure you all will agree that when children and families thrive, we all benefit from a stronger economy and a more prosperous state. We hope state lawmakers will prioritize long-term investments to improve the quality of life of children and families across the state. For nearly 20 years, PNC has supported quality early childhood education through $211 million in grants and more than 1 million employee volunteer hours. We also impacted the lives of 8 million children through PNC's Grow Up Great and our collaboration with early learning experts and nonprofit organizations, including the Sesame Workshop, the National Head Start Association, and Fred Rogers Productions. We remain committed to this work because it's the right thing to do. In closing, I'd like to share just a couple of sentences from a TED Talk I did in 2019 focused on early childhood education. The title of that talk is "The Time to Invest Is Now." As we build human capital, poverty diminishes and prosperity is sustained. As business leaders, it is our strategic and civic responsibility to plan for the future. Our society's growth and the economic dividends we can expect and need depend on our thoughtful investment in early childhood education. I see a community thriving and alive by investing differently in education. Their success as individuals and our future as a society depend on it. The time to invest is now. Thank you.
Thanks, Dave. We're grateful for PNC's leadership in this space, not only in the Miami Valley, but throughout the state. It's now my great pleasure and honor to introduce my colleague, Dawn Buskey, who has many, many roles at ProMedica, but the most important and my favorite one is president of the Russell J. Ebi Children's Hospital. Very active in Northwest Ohio on multiple levels, but she's also vice chair of the Ohio Children's Hospital Board of Directors, and she's here to introduce our keynote. Dawn.
I'm glad to see everybody's back from their break, and we're trying to catch up on a little time here. It is my pleasure to be here to introduce our distinguished keynote speaker, Dr. Brenda Jones Harden. By now, you've heard some of the reasons why Vote for Kids, the coalition, is passionate about creating a strong foundation for Ohio's children. No one knows how critical these early years are like Dr. Jones Harden, who's coming to us today as the Ruth Ottman Professor of Child and Welfare at Columbia University School of Social Work and the President of the Board of Directors for 0 to 3. For more than 35 years, Dr. Jones Harden has focused on the developmental and mental health needs of young children and environmental risk, specifically children who have been maltreated, are in the foster care system, or who have been exposed to multiple family risks such as maternal depression, parent substance abuse use, and poverty. She's an expert in the infant and early child mental health and child welfare, and we are thrilled to have her here today. So please help me welcome Dr. Brenda Jones Harden.
Thank you. Thank you. Thank you. Thank you for that nice introduction, and thank you for the Leadership Forum for bringing me to Ohio. I have to tell you all, for the last 30 years, I've been coming to Ohio about 3 or 4 times a year to visit my husband's huge family in Dayton. He has probably about 50 first cousins who all live in Dayton. And when we come up here, we have these big family gatherings where we go to church and everybody's singing. I had never experienced anything like that in my life until I started coming to Dayton. So I am hoping actually that they don't know I'm here because I am going home. I'm not going down the road to see them, so fingers crossed. Anyway, I'm here to talk about the things that really have driven my career for now almost 40 years, if you all can imagine. I started my career as a young social worker. My mother said, I did not raise my child to get killed in the tenements of New York City, which is where I learned about the import of the work that I would spend all my adult life working on. Now I'm not going up the stairs of those tenements as much as I used to, partly because I have arthritis and can't walk up all those stairs. But the other reason is I really thought about how I could make a bigger impact. And I remember my advisor in graduate school, because my first degree was in social work, my second degree, my doctorate degree, was in psychology. And he said, you can impact the 12 kids, 15 kids you might have on your caseload, right? Or you can impact the thousands of kids in America who need somebody to advocate for them. He went on to say you can advocate for them from the advocacy platform, but you can also advocate for them as a scientist practitioner. And that's what I've spent the last 25 or 30 years trying to think about. How can I distill what we learn from the science about children to people like many of you in this audience who work with children's programs on a day-to-day basis? So that's what I'm here to do. They only gave me 30 minutes. How can I talk about the things that I've spent 40 years doing in 30 minutes? But I'm gonna try. All right, So the first thing I want to do is start with a quote. I'm going to start with a quote, and I'm going to end with a quote. And I love this one. I give it to my students. I only teach one class a semester anymore, so I can't do all that anymore either. But I start with this quote, and this is from Nelson Mandela. And he said, "There can be no keener revelation of a society's soul than the way in which it treats its children," right? And I would argue that this leadership forum is showing that you all have a soul, that you are really trying in the best ways all of you can, from the business community to the human service community to the hospitals, to really try to make Ohio's children's lives better. And so the things that you all have listed as a priority, the things you want to work on, are the things actually that I've spent the last 40 years or so of my adult life trying to work on, okay? So I'm going to do two things today in my 30 minutes. One is to try to tell you why this is so important, and then to talk a little bit about what we think we know will make it happen. So let's start with poverty. What I say to my students is this is the great disequalizer, right? Poverty. And yes, mental health, and I was trained as a mental health clinician way back then and continue to see kids for many times at National Children's Hospital, by the way, in Washington, D.C. Spent 4 years there seeing kids as a mental health practitioner. Here's the thing, that poverty, yes, as somebody said earlier, it crosses socioeconomic class, it is true, but poverty has the impact of making everything worse, right? Creating disparities that all of you know about. So one thing I want to say to you, I don't know if you paid attention to the recent New York Times article, a week or so ago it came out, showing that child poverty is on the decline. Hallelujah. Did we ever expect to see that? No. And I'm going to tell you why they said it was on the decline in just a minute, but it is on the decline. But the thing you need to pay attention to, and this is why researchers, I'm glad Governor DeWine talked about research, but one of the things that researchers are arguing is that we have to disaggregate our data. So we can't just look at overarching trends because, yes, it looks like poverty's on the decline, but there are a couple things that you should know about that decline. One, that there are disparities in the decline. So children from minoritized backgrounds still experience higher rates of poverty than white children, not middle class, white children, right? But the other thing is that something happened in 2021. And what that was the child tax credit. Right? Now, all of us had hoped that it would catapult us into an era where all families continued to get it. We didn't get that. But now we have data that shows that you can precipitously decrease poverty, child poverty, with the child tax credit. And so if I were you, I'd be pushing for something similar to that for the families of Ohio, since it didn't pass in the federal government. The other thing that I would mention, which is consistent with this whole leadership forum, is that young child poverty is the worst. So yes, we have seen poverty decrease, but there is an age disparity that young children tend to experience more poverty than children of any other age group. And the bad part about that is it's more pernicious. What that means is that young children who experience poverty experience it longer, right? Because they're starting earlier, that makes sense. But the worst part of it is that their outcomes are worse. For some reason, older children, maybe because it looks like their families cycle in and out of poverty, but older children tend to experience fewer adverse outcomes than young children. So my argument is, and again, I was trained as a mental health clinician, is that if we don't do something about poverty, all of our beautiful treatment, and I know we don't have enough child psychiatrists, which I've learned about from my colleagues, and we don't have enough psychologists, and we don't have enough social workers to do the mental health work. We need to do something about that workforce, but if we don't really try to address this kind of structural issue, we are going to be in trouble, okay? So my colleague and I just wrote a paper on SES disparities. We did a review paper just turned in a month ago, and this is our graph. And I decided to put that in there because what it suggests is that poverty is a very complex phenomenon. It's like my advisor from grad school, who was one of the architects of Head Start. His name was Edward Ziegler. He died a couple years ago, and I bring him in to every presentation I have because he really said, when he was dying, I depend on you all to keep my message going. So this is partly for him. But what he used to say to us is that poverty by itself is not really the issue. It's everything that goes along with it that's the problem, right? So it's living in segregated, poor communities. It's living with school systems that are really terrible. If you all know about the early childhood work, you know that we can see, like the person who was right before me talked about Perry Preschool, right? Well, we still have beautiful exemplars of programs like Perry Preschool. You get these kids up, you get them ready for school, and guess what happens? The data show us that they don't stay ahead. The Tennessee study you all may have just heard showed that kids who had Tennessee pre-K looked worse than the control kids. Why is that? One reason is because of horrible schools that they end up going into. So that's a problem, and we have to do something about that. And we have to do something about supporting the families with whom these children live. We can't leave them to try and figure out how to keep their children safe from violence and tell them at the same time we want you to volunteer in the classroom. Asking a little much. So the issue is, and I know this is a complex figure, but what I'm trying to point out to you is that there are so many things that we have to address to get children to where they need to be. Okay. I am not a brain scientist, but one of the things in my field now is that if you don't get on the brain train, you do not get any funding. So I have to tell you this. So my most recent study is a study where we're looking at, with two colleagues who know about the brain, because I'm a consumer of this science, but I have a great colleague who's been doing EEG for 50 years, and I have another colleague who's been doing MRIs for like 25. And so the three of us are the PIs on this project. That's a national project, 25 sites across the country, where our question is simple. What is the impact of early adversity in children's brain and behavior? That's the research question. Now, let me tell you, that study is one of the most complicated studies I've ever been involved in because we have to find moms who are willing to bring their newborns in to have a brain scan. Wish me luck, wish me luck. But at any rate, the data are pretty compelling already. NIH wants us to be able to have 7,000 kids. That's what we're supposed to end up with, not just my site, but all the 25 sites, 7,000 kids across the country, because they want to move beyond these little studies that we have. But what the little study suggests is that poverty affects children at the level of the brain, not just their behavior. So if their brains are being affected, why are we surprised that they are throwing chairs in the Head Start classroom? Why are we surprised that they can't learn their ABCs, right? Now, this is the temporal lobe, and for those of you who are consumers of the brain science like me, you will have learned that the temporal lobe is this part of the brain right above your ears, right? There's a reason it's right above your ears. This is how you process language. And for those of you who don't know the developmental literature, language predicts everything. It predicts whether you learn how to read. It predicts whether you can learn math. It predicts whether you have high rates of behavior problems. So oral language turns out to be so critical. And what this particular slide shows us is that when you are experiencing deprivation, that part of your brain is affected. Now, this is a PET scan. It's not an MRI scan. It's a PET scan, which, and my colleagues from the children's hospitals will help me if I get this wrong, but my understanding is that it's what helps you, tells us whether the brain is processing glucose, right? The metabolism of the brain. And usually, these kinds of things occur, these PET scans in our kind of research, when you're given a particular problem to solve. Like, being able to, repeat words or know what picture matches a word like you do with a PPVT test or something like that. And what this is suggesting to us is that for children who've experienced deprivation, they are not using the same amount of energy to process a problem. And if you're not using that brain energy to process a problem, you won't solve it. So again, why are we surprised that our children look so bad when we look at their achievement scores? Okay, I'm not going to go through this. You all know this. I just wanted to point out about poverty again, the great disequalizer. It impacts physical health outcomes, and somebody mentioned infant mortality. And you all know that the reason children mostly die are because of prematurity, and we got to go back, not just focusing on the children, but I got to focus on their moms and make sure they get the correct OB care. There is a lot of research about women feeling like they are not heard when they come into the hospital and they say, something's wrong, I don't feel like something's going right the way it's supposed to be, and people don't listen, right? So if we're focused on child outcomes, we gotta focus on maternal outcomes, particularly in the perinatal period. And you all know about the maternal mortality rates, particularly among African American women, higher than any other group, higher than poor Latino women even when they're in the middle class, which suggests, okay, that complicated part about poverty, racism you have to think about, and how Black women experience the healthcare system. There's a lot of research about this. If you don't believe me, go look. Listen to Serena Williams. She'll tell you about it. Okay, so you all know about the achievement gap. I'm not going to go into a lot of detail. The only thing I want to say to you all is the achievement gap does not start in elementary school. It starts in early childhood, right? And we know, oral language again, if we look at the oral language of 2-year-olds, we can predict whether they're going to be ready for school. So as someone said about the mental health problems in that video, and she was absolutely right, we can predict later mental health problems in preschool. We can also predict academic failure in preschool. Okay, so we really got to, if we're really thinking about prevention, and I started my work working with kids of all ages, but if you have followed my career, if you look at my Vita, I've gotten younger and younger and younger over the years because I'm so committed to this prevention idea. Okay, I'm not going to say a lot about ACEs. I just want to say that you all know, now we got money for it, that ACEs predicts physical and mental health problems. I knew that 40 years ago. But now we got beautiful brain pictures, and we got physicians looking at it who are now relating it to physical health outcomes. So now everybody wants to give us money, which I'm happy to take. Now, here's the thing that I want you to remember though. Just because you've experienced ACEs does not mean you're gonna have bad outcomes, right? So what we have to learn, and this is the resilience literature that comes out in my field, we have to see what those children who have good outcomes experience. What is it that they get that other children don't? And we've learned some of that. One of the things we've learned comes right out of Jack Shonkoff's Center for the Developing Child, and if you all haven't looked at his website, beautiful things that you can use to train your staff, to advocate, free, you just download it. But what he argues, he has this framework called toxic stress, and you all might remember this. But the important thing that he argues is that yes, children experience poverty and violence and maltreatment and racism and segregation and all these bad things that we know cause them to have adverse outcomes. But he argues is if you have the protection of a responsive, stable, caregiving environment, your outcomes are not as bad. So while we fight to get another child tax credit, while we fight to decrease poverty, while we fight to decrease racism, which all of us as advocates should do, there is something we can do for children in the interim that might help. And that is making sure that they have the kind of responsive caregiving environment that we know will help them have better outcomes. Now, does this have to be mommy? No. Does it have to be daddy? No. Does it have to be grandmommy? No. It can be a good child care worker, which is why if we don't pay these ladies, don't get me started on the workforce issues. People want to know why we're losing them in droves. Ask yourself what their paycheck looks like. Ask yourself, are they any better off than the families they serve? It's pitiful. All this brain research where we know how important stimulating children's minds are in the earliest years of life, how plastic the brain is in the early years of life. And we are paying these ladies what we pay them. And you all know they're primarily women of color, right? That's who they are. We should be ashamed. So again, a question I'd be asking the people who are running for governor in my state is, what you gonna do? And I don't just wanna see retention bonuses, although I'm so happy that states are moving toward those retention bonuses. I'm really happy. But I wanna see them start at a reasonable pay that really is consistent with what we're asking them to do. Okay, so this particular slide really just says what I just said, so I'm not gonna stay here long. That if you're really serious about prevention, you know that you get the most bang for your buck. And this is about the brain, but if you look at the return on investment that the economists like Jim Heckman are talking about, you see the same kind of trend. You get more outcomes for what you invest if you invest early, which is why this forum is so important. We really need to be not waiting until those children are showing up at the children's hospitals at 13 with a suicidal threat, right? Because if we can get to these parents and help them understand who their children are, how they have to respond to them, what they have to do. There's even some research now that says that spanking affects your brain. Now, this is a tough issue for me. I come from a family of spankers. I can't tell you, I was spanked with a belt, I was spanked with a paddle, you know, I had a forked switch at my grandmother's house, and I used to have to go get the switch off the tree. You know, this is where I come from. So imagine me saying to my family, I am arguing against spanking, and they say, see, that's that Yale degree. They don't appreciate it at all. But the point I'm trying to make is there are things we know that we need to help parents to do early on. And we're not getting to them. We're not helping them see what they need to be doing. Okay, I'm gonna skip this slide. I wanna say that if you are really serious about taking a prevention strategy, you need to think about it from multi-levels. And this really comes right out of public health, right? Which says that you have to think about what you're doing for the whole population, like we do not have a population who knows how to parent. We should be doing something for all of our parents about parenting. Maybe they can get it in high school, maybe they can get it at the children's hospitals, but someplace, maybe they can get it through the home visiting programs, someplace where parents can learn what is it that makes a difference for my kid, right? But also, primary prevention, this is where we can think about making sure every parent starts their family with a reasonable income, right? That's the other thing. And by the way, we have learned one of those reasons for that reduction in child poverty also has to do with the expansion of the safety net. Now, there are people who don't like TANF, even though we've made the changes very different than what it looked like when I first started my career. Medicaid, SNAP, and I have a slide on that I'll get to really quickly, but those safety net programs make a difference in terms of whether parents are able to do what they need to do. Okay, and on the secondary side, we have things like the early care and education that you all have been talking about all day. But I gotta say this one thing about early care and education. You all heard my, very distressed comment about what we don't pay. The other thing we don't do is know what's happening in those classrooms. And if teachers are stressed, which a lot of our teachers are, because as one of the people in the video said, 4 little challenges. I love the way she put it, 4 little challenges. I would have said something different. But what she's talking about is teachers. I had a teacher in one of the classrooms that we worked in where the kids were hitting her with their fists. And she had 17 boys and 5 girls. Now, whose bright idea was that to put 17 little boys in one classroom? I don't know. But the point was, she was so tired. I would not have let that teacher be in that classroom by herself all that time. Now, she had an aide, but the aide didn't know what she was doing. That's the kind of teacher who we should have put our arms around, given her more people in the classroom, and we ended up using our research team to go in and help her, because it was ridiculous. She could not do her curriculum. She was too busy trying to keep children from knocking each other on the floor. So we can't just say, are they meeting we have QRS in our state, but the quality standards. We need to be in those classrooms, supporting those teachers to deal with the kids that they have. And then finally, all the mental health interventions that you all know really well. I just want to say one thing about the mental health interventions, and obviously I have been one. It is a very singular kind of intervention. And I had a colleague who said, school is the best form of mental health intervention. And what he was arguing was what you get in schools, a good school, by the way, he wasn't talking about some of the schools we see, but the routines, the adult support, the helping you get along with peers, the ability to give you something to focus on instead of thinking about the gang activity and the violence in your home, that is a mental health intervention in and of itself. So I want to encourage you all to think a little more broadly about what mental health support is and think about it in terms of providing children with the milieu before they end up in the hospital that might get them the positive social outcomes we want. This is my slide quickly on safety nets. I am sorry. We gotta keep these alive. And there is some research that suggests in states with expanded Medicaid, with more flexible TANF requirements, with expanded eligibility for SNAP, you can see things like reduced child maltreatment. So my argument is fight to keep these alive in your state. All right, And then I want to say something about your integrated service delivery system that you raised. There are a lot of my colleagues who've talked about this. I'm an early childhood person, as you all know, so we think about it in terms of early childhood systems. But one of my colleagues, Ken Dodge, has a program in North Carolina called Family Connects. And he really believes in that multi-pronged, multi-level prevention approach. And he has written several papers, look them up, Ken Dodge, where he argues for a more universal population-based approach. And he feels, and we'll see if he's right, because he's tried this out in North Carolina, he feels that if we go at it at a population base, there'll be less stigma and we'll get to all families, right? And so his program provides a home visit to every mother who is born in Durham, North Carolina. Every mother who delivers, sorry, not born, every mother who delivers in Durham, North Carolina is offered a home visit. And in those 1 to 3, sometimes they get 3 home visits, they make a determination whether a parent, a family needs more support. And from there, they go on to their early childhood system of care that includes early Head Start and Head Start, that includes child care, that includes infant and early childhood mental health, that includes a medical home in their community, that includes child welfare services, who, by the way, have more prevention money than they used to have. So we don't like to think about them as a partner, but they should be a partner. They should be a partner. And he is able to get families to those different places. So I would encourage you to think about a couple things in terms of that. Having a central registry, if you will, a central way that families come into your human service system and figure out what they need. Now, this requires a lot of collaboration, but you all have the kernels of that right here, right? Where you can create this kind of system. Washington State has done some amazing work in this area. New York is doing some work where they're bringing all these siloed child serving systems together, and they're really thinking about how can we use our money more efficiently and use our money more wisely and make sure that, because it's the same kids, as you all know, you go to any system and you got the same kids and families who are served by most of these systems. So they're using their money in a more cost-effective way. I'm gonna end because I know that I only had a certain amount of time and we're already late, and I said I was gonna end with another quote, and this is Thoreau. Remember Walden, going to the woods, and this is what I do when I get burned out. I go to the trees. My mother says I'm a tree child. That's what I do on my birthday. I find the park that I haven't been to, I go to a different park. I don't want a party, I don't want birthday cakes. I need to go sit by a tree and calm myself down and think about what am I gonna do and how to keep myself from being burned out. And I've been doing that for a long time, and it helps. But anyway, this is Thoreau Walden, who first introduced this little urban child from DC to how you can go meditate in the woods. But this quote is, kindness to children, love for children, goodness to children, these are the only investments that never fail. And that's what I've kept myself doing all my career, and hopefully you all will too.
Yeah. She said I was a great host, so my boss is out there. You hear that? Thank you, Doctor. Powerful, powerful messages, and obviously a message that resonates very well in this room and one that we're wanting to take even broader. So we're picking up some time, lots of great content today. So it's my great pleasure to introduce our colleagues from the United Way of Cincinnati. Christina Scott is the Public Policy and Advocacy Director for the Vote for Ohio Kids Platinum sponsor, United Way of Greater Cincinnati. There she is. Come on up. Thank you.
Well, Dr. Harlan may be a professor, but I think she took us to church. Thank you. Give, advocate, volunteer. At the United Way of Greater Cincinnati and at United Ways across the state of Ohio and the nation, that's how we live united. If you're here, you understand the power of the nonprofit community to shape public debate on important issues. Over and over again, I've heard from families, from educators, from United Way supporters, and my colleagues that Ohio's future prosperity depends on our ability to foster the health and well-being of the next generation. When we as a society invest in children and families, the next generation will pay us back. Mental health disorders are preventable, treatable, and curable. While those of us who are experiencing mental health disorders can achieve well-being when we get access to the right treatment, many of us with mental health challenges don't get the care we need. That's why we have children in emergency rooms, because that is the care of last resort. Only half of youth with mental health illnesses get the services they need, and even fewer Black and Latino children get treatment. We must improve the service system so that our families who need service support get it when they need it, where they need it, and in the format that works best for them. But that's just the beginning. My boss, CEO Moira Weir, is a former child welfare worker and led Hamilton County's Job and Family Services Department for many years. She brought us into an era where we know it's not just enough to make sure that we get folks the treatment. We need to prevent these challenges from impacting future generations. More children need to live well, so they don't need the service system at all. And with just 33 days away from an election that's going to shape the future of our communities, our state, and our country, we have a lot of decisions to make. While 501c3 organizations like the United Way can engage in education and advocacy to promote the issues we care about the most during an election season, we're strictly prohibited for supporting or opposing candidates for public office. So how can 501c3 organizations respond to candidates or political parties and remain nonpartisan? Like the format of the program today, by being very deliberate and careful. And so here are my very deliberate and careful remarks about how you can use your power as leaders and as Ohio voters and put children at the center of our policy agenda. There's unprecedented agreement that mental health of children is one of the key challenges of our time. And there are many ways and choices that our policymakers have to both address the current moment and to prevent future crises down the road. We're here today to hear our candidates for governors' two different visions for creating a community where more children can achieve their full potential. What we can do is educate ourselves and vote. We can also use our voices and talk with our friends, our families, the people in our Sunday school classes at church, people at the water cooler at work, and talk about the choices that we have in front of us and why we're making the choices. We can use our individual voices. And after all, kids can't vote, but adults over the age of 18 can. And if you're like me, you probably vote for dog catcher. That's my joke. I showed up and voted in an election this year where there was nothing on the ballot that was opposed, but I really do love going to vote. And think it's really important for me to talk to my colleagues and friends and families and make sure that they have a plan to vote and that they go vote. So I'm gonna ask you to do that. I'm also going to ask you to follow the example of groups like Groundwork, who has put together a Parent and Family Voices Committee. Some of the members of that group are here with us today, and I'm really pleased to have some of the folks from Cincinnati at our table. We need to put children and families at the center of our decision-making processes. We need to shift power to them and ask them to give us their answers on how we build a healthier community for all. With your influence, your engagement, and your advocacy, we can hold our elected officials accountable for the promises that they make us. And I guess ending with a quote is a thing today. So I'm going to end with a quote from Margaret Mead, and it's actually, I'm going to paraphrase her, but never underestimate the power of committed people to change the world. And in fact, it's the only thing it ever has. So please, you are 800 committed people. Let's have a multiplier effect and make sure that we all vote for Ohio's kids. Thank you.
Thanks, Christina. We're going to flip the stage. Lunch is being served. We're going to start just a couple minutes earlier than what's in your program, but please feel free to enjoy your lunch, and we'll get going here in just a few minutes. Hello, hello. This is your voice to ask you to return to your seats, please. It's my pleasure to introduce one of my great colleagues, Melissa Warby Arnold, who's president of the Ohio chapter of the American Academy of Pediatrics. For those of you who know Melissa and our incredible pediatricians in our state, you know, they receive numerous awards for national recognition for the advocacy that the Ohio chapter leads and how other states always look to her and her team of how to improve advocacy for kids. And as my good friend Jim Anderson used to tell me, this is my quote, "Attention is the currency of leadership." So here we go. Melissa.
Thanks, Nick. Sorry, I know I'm interrupting your lunch here, so I'll be brief. But I just want to say, on behalf of the 2,900 pediatricians and pediatricians in training who are members of the Ohio chapter of the American Academy of Pediatrics, we are happy to support today's event and the collective work of all advocates and elected officials to help keep health and the well-being of Ohio's children at the forefront of our legislative priorities. Prevention is the key to pediatric medicine, and today you have had the opportunity to be informed and motivated to make sure we focus on prevention as a key strategy to move the needle in child health back to a place where children have the support they need, from their physical health to their mental health. And while the Ohio AAP stands with our partners in that battle, our members are also fighting the battle each and every day to move children and adolescents from crisis to resiliency. Since 2010, suicide for adolescents has increased by 28%, and emergency department visits around mental health issues have increased by up to 60%. Our emergency departments across the nation are experiencing unprecedented wait times for up to 5 days where they're boarded in an emergency department waiting for mental health beds. During this time, these children are unable to leave the facility and many times not even able to take a shower while they are waiting for services. We need to do better for our children, and together we can. In 2015, the Ohio AAP began the Store It Safe program, focused on keeping kids safe from unintentional injuries due to firearms. And in 2017, we expanded that program to also focus on intentional injuries to reverse the trend of irreversible actions surrounding adolescent suicide. Our goal is not only to put a barrier between a child's thoughts and fatal actions, but to work to provide families with the information from their pediatrician to educate them before a crisis occurs and how to respond when it does. And finally, we are now working to focus efforts on helping to support patients and families in Ohio with building resiliency to provide the support system they need to grow and reach their full potential. The Ohio AAP is thankful for the investment made in the Store It Safe program by our current administration, as well as many partners and advocates on the local and statewide level. And we call on every person here to not only advocate for an investment in prevention, but also an investment in resiliency. Now I'll let you get back to your lunch. Thank you.
Thank you, Melissa and AAP, for being our luncheon sponsor. We're going to have our second video, and as soon as that video concludes, we'll invite Pat, Gloria, and Debbie back up to the podium, or the seats, along with Mayor Nan Whaley. So cue the video, please.
What's the best investment we can make? Ensuring our children and families thrive. They are what make Ohio strong. But COVID-19 has exposed what many families knew even before the pandemic. The mental health crisis, the child care crisis, the learning and workforce crisis are overwhelming them. Employers are paying the price too. They don't have enough workers. And that gap is threatening Ohio's competitiveness. The stakes are high. If Ohio is going to stay strong, we need to move from crisis to prevention.
It is so much better to do prevention work. That preventative work is going to spare the society in general tons of money in treatment.
What we've all noticed is that kids are
getting sicker. They're more severe before they ever get into treatment. If we look at Dayton Children's, over the past year, we admitted over 1,000 children to our hospital for suicidal thoughts.
We have close to 100, if not over 100, depending on the time of year, children hospitalized every day at Cincinnati Children's Hospital just for mental health issues. Because I've had families say it'd be easier if my child had cancer than if they have a mental health issue, because at least if they have a physical health problem, there's a clear pathway, there's resources, there's not shame.
Seeing elementary kids who are contemplating suicide, feeling hopeless.
When you have a 12-year-old, a 10-year-old who is violent, that didn't start when they were 12. That started when they were 2.
I see families who drive 2, 3, 4 hours to see us.
We're rural Ohio, and we notice that Cleveland, Columbus, Cincinnati areas, they get a lot more attention, but we would like to see that change when it comes especially to mental health.
The child's problems is almost like the alert that the family is struggling.
COVID-19 hasn't just shown a light on the mental health crisis. Families need and want to work, but childcare and early learning programs have closed, or they have long waiting lists, or the cost is so high it doesn't pay to work. Families and employers need us to come together and invest to make high-quality early learning and childcare a reality, not a hope or a wish.
If you've never not been able to afford childcare for your child, it's hard to understand what that's like, trying to decide, okay, well, do I stay home? Do I put my career on pause?
I have applied for child care assistance and being told, well, you make just too much. I kind of feel like it's a catch-22.
Women want to go back into the office or into their jobs, but they aren't able to find care. All of that goes back to the wages and the teacher stress through the pandemic.
What we are hearing, particularly from our Black and brown families, is that they just missed the cut. They may be $1 over the income guideline.
We shouldn't have to put them in a position where they have to make a choice of, do I send my child to a next door neighbor or to grandma's house where they'll do their best, they mean well, but they really don't have the educational background to really lay that foundation that a child needs for quality education.
When I hear folks call us babysitters, I invite them to see what we do.
There's this understanding among business leaders that you need employees with strong executive functioning skills. But what I think isn't readily understood is the fact that those skills are formed in the earliest years of a child's life.
I feel like I'm doing my part. I work, pay taxes, I'm a productive member of society. I'm holding up my end, but the other end isn't being held up.
We need parents at the table. If we don't have those parents at the table to help with those issues, how do they know what we go through?
Our message to the next governor would be, have a children's agenda. Have an agenda that is integrated, that doesn't have individual programs that don't work together.
I think that there are those that believe that kids are just going to catch up over time. I don't believe that's going to be the case unless we make some very strategic investments, that we prioritize supports for these kids and families.
While we often talk about children being our most important part of society, we don't frequently follow through with it. This is a chance for them to make children a real priority.
Another powerful video. Let's remember those voices as we move to our second and final candidate spotlight. I'd like to please invite back up to the stage Debbie Feldman, Gloria Blevins, and Pat Teaberry. If you remember from our first discussion, the panelists will each ask the same questions of former Mayor Nan Whaley that they asked of Governor DeWine. No additional content is allowed based on our commitment to nonpartisanship. Both candidates again receive the same background information, and you can read their responses to our questions that are contained in the program. It is my great pleasure to now introduce the former mayor of the great city of Dayton, Ohio, Nan Whaley. Her distinguished bio is also in the program, so in the interest of time, we're going to turn it over to you, Mayor.
Thanks a lot. Well, good afternoon. I'm so excited to be with you all today and talk about issues that are incredibly important to me. As you all may know, I made supporting kids a main focus of my time as mayor of Dayton. We were the first major city in the state to create a paid family leave program for new parents. Now, you know mayors don't have much control over schools, but we knew kids were coming to kindergarten unprepared. So I led the effort to pass high-quality preschool for all 4-year-olds in our city. It was so successful that we expanded it to include 3-year-olds and several suburban neighbors of ours. Now, I will continue that focus as governor. My administration will expand support for child care to 250,000 more families so that folks aren't choosing between caring for their kids and going to work. We'll create a portal to connect parents with high-quality preschool programs and instruct Jobs Ohio to make child care and preschool a priority industry for investment and support. Now, I know Governor DeWine was in here earlier talking about his plans for Ohio kids, but the unfortunate truth is that these are just an election season talking point for him. He has failed to deliver for Ohio kids. Under his watch, we have dropped in national ranking for measures of kids' well-being. We are now ranked 31st in the country. He wants to give parents a little discount on baby products, but his abortion ban meant a 10-year-old who was raped had to leave Ohio for the care she needed. He's putting more guns in schools, which will make kids less safe. He says he wants Ohio to be the best place to raise a family, but he hasn't done anything like that to make it a reality. In fact, he's taken us in the opposite direction. And what is really sad is he won't actually debate me on these issues. He was here an hour ago, and that's the closest we'll get to a debate. He may be afraid to talk about the issues and his record, but I am not. So I'm excited to be with you all and talk about the future of Ohio and the future of Ohio's kids. Thank you.
Well, Mayor Whaley, I have the first question.
Sorry. You said it was right there and then I forgot.
Good. Okay. The pandemic has exacerbated behavioral and mental health challenges facing Ohio's children and their families. The National Survey of Children's Health found that more than 1 in 4 children between the ages of 3 and 17 reported having a mental, emotional, developmental, or behavioral health problem in the 2019-2020 year. Our babies and toddlers are also impacted by this crisis, with Ohio polling finding that 7 out of 10 parents of 0 to 5-year-olds were concerned about the mental health of their children. If elected governor, what steps would you take to both prevent and mitigate the impacts of the mental health crisis facing our youngest Ohioans and their families?
Yeah, this is an enormous issue for Ohio, and we saw just, I think, last week, right, Debbie, in the Dayton Daily News about it's the most common reason why children are admitted into Dayton Children's today. And we see, frankly, that we've had mental health services just gutted to the core. And this has been going on for a long time. We remember just general mental health services being cut in Dayton even before I was mayor and continued on. And particularly for our youngest, we see the stress that's been even more exacerbated because of the COVID pandemic, where kids weren't able to leave their house, they weren't able to see friends and family, or able to go to school. And so we've seen this be even more exacerbated because of the pandemic. Frankly, we need to have more mental health supports in schools and more wraparound services, and then we need to make sure that we have pathways for people to not just have the mental health services in schools, but to be able to get the care they need so it doesn't become an emergency room crisis point where kids are at their breaking point, that we can identify that early, make sure we can get them to places. To do that, we have to have real fundamental, long-term, sustainable funding. We can't just use one-year grant funding because we have to make sure that we have those pathways in place. And that way, that also makes sure that mental health providers want to get into this business, right? We also have an incredible shortage, both for all mental health providers, not just ones that provide for children in this state. It's one of the big issues we see. So making sure that that has accessibility, that it is funded long-term, and that we just don't think of mental health providers as an afterthought. I think those are the key points that we need to make sure that we're doing. And frankly, it's just going to take funding from the state to do that. What I've seen across the state is, for example, in Montgomery County and Dayton, we have local funding. We're able to provide local funding to do a lot of mental health services. But in communities, for example, like Portsmouth, there's no funding to be had, and so it just doesn't exist, and it makes the entire state completely unequal. And so I think we have to have the state be an investment if we're going to be serious about having real mental health, not just community by community, but statewide.
Thank you. I have your next question, Mayor. Even before the pandemic, many Ohio children were exposed to or experienced trauma or adverse childhood experiences, which we know as ACEs, which can include child abuse and neglect, parental incarceration, and living in a household with someone who has a substance use disorder or mental health problem, which can lead to risk of poor health outcomes later in life. If elected governor, what steps would you take to build safe, stable, and nurturing environments for Ohio children? And how would you prevent and mitigate the impacts of children's exposures to ACEs?
Every child in every community deserves to live in a safe community and with opportunities to grow and to learn, no matter what zip code you're in, no matter what community you're in. That's what we have to make sure is our end value. And to do that, we have to make sure that we get to the root cause and just not deal with the symptoms of what we're seeing from children. And particularly, I think that's about investing in all communities. It's about tackling gun safety and gun violence in our communities and tackling addiction. And so I'm going to talk particularly about the last two, about gun safety and addiction issues. What we've seen in the state, particularly around gun safety from this governor, has been the exact opposite of what we need. First we saw, signing of Stand Your Ground, which makes it much less safe in our communities, particularly for African Americans. We saw the signing of permitless concealed carry, which makes it more dangerous for officers. Law enforcement was against. It increases officer-involved shootings by 14%. And then in the wake of Uvalde, the answer was to arm bus drivers, teachers, and cafeteria workers with very little training, even though they didn't want this added responsibility, and law enforcement thought that was a terrible idea too. That's what we're getting right now from the State House. What we need to get, and what we need to get from the governor, is universal background checks, something that 9 out of 10 Ohioans agree with. So we don't have to have the constant worry of going to a grocery store, going to school, going to a restaurant, and worrying about a shooting. And then secondly, we have to pass red flag laws and extreme risk protection orders. We know that that makes a big difference, particularly on gun safety, particularly on mass shooting issues. And we've even seen states like Florida and Indiana get this done. So this is not like some wild liberal idea. This is something that works, it keeps our communities safe, and we also need to just roll back senseless ideas like arming teachers, bus drivers, and cafeteria workers with very little training. That does not help our schools, and it does not help our children, and frankly, I think exacerbates the problem inside our schools every single day. So that's the key issue, particularly around gun safety, that I think is so important. The second issue around tackling opioid and just addiction in general, when I came in as mayor in 2014, Montgomery County, I think, led the country in accidental overdose deaths with opioids. And what Dayton and Montgomery County did is, particularly with the great work of our Adamus Board and public health, it's brought everybody together. We're big fans of the collective impact model. Over 200 folks of different nonprofits, justice system, police, businesses that were affected by workforce around opioid addiction worked and came together to solve problems around the addiction issue. Because we did two things, we treated opioid addiction like the disease that it is and really worked on breaking stigmas around addiction. And then secondly, holding the drug companies accountable. We were the fourth city in the country, the first in the state to sue them, and we won to provide services. And then finally, making sure that we had long-term care around addiction services. And I mentioned Portsmouth in the first answer. I want to talk a little bit about this. In Dayton and Montgomery County, what we saw is like a 30-day bed, which is what you can get from Medicare and Medicaid, is not going to make the difference when you talk about overdose and addiction issues. This is a real beast, and you have to have long-term care to get that done. Now, in Montgomery County, because the community is able to fund, they were able to fund a lot of that locally. When I visited Portsmouth, Ohio, there's no funding there for that. So all they have are these 30-day beds that are not working, there's too many of them in the community. They have no standards of care. And then the community gets mad at those people providing addiction services and those in addiction themselves because they see no movement long term. And this is where the state can definitely engage. We can't just have some communities understanding that, being able to pay for this and some not. Because of the work Montgomery County and Dayton did, we were able to cut accidental overdose deaths in half. And we actually were one of the few places in the country that during the pandemic did not see a rise in accidental overdose deaths, which shows that that sustainable work and that collective impact model and long-term care is really key. That's what we have to get around these issues, particularly around ACEs. And I think you all know there's no silver bullet on this issue, but you have to look at best practices that work in local communities and then figure out a way to scale that so the entire state can benefit. And that's the work I think that the governor has failed on and really has done none of these issues. Talk's a good game, but then cut stuff to the bone to take care of the very wealthy in this state. Thank you.
Ohio's children are behind in academic readiness, and there's a limited access to quality early learning and early intervention in Ohio. In the 2021-2022 school year, more than half of children, 62.1%, were not demonstrating kindergarten readiness, with alarming disparities in children experiencing economic disadvantage. It's vital that Ohio's children are ready and prepared to meet the demands of our state's evolving economy as they grow into the future of our workforce. Providing high quality, accessible early learning sets them up for success later in life and yields a substantial return on public investment. At the same time, many of Ohio children lack access to quality early learning, including 350,000 children from low-income families. If elected governor, what actions would you take to promote equitable access to quality early learning opportunities that prepare our children for life and success as our state's future workforce?
Well, clearly, Pat, this is something I'm very proud of. It's one of the two things I'm most proud of as being mayor of Dayton, was passing and working to get high-quality preschool into Dayton. And look, I think I have to say the great work that Learn to Earn and Ready, Set, Soar have done in Dayton has been phenomenal, right? We've seen 88% of our kids be enrolled in 3 to 5 stars for early learning because of the work that the community's done around Preschool Promise. And what I think is exciting about that is we actually saw during the pandemic, child care providers in Dayton actually increase their star step up to quality during the pandemic. And that is directly because we supported our child care facilities during that entire time and continue to do that on this exercise and making sure we have quality preschool. The second thing I'm proud of and why I think Dayton is a national best practice in this is we open the model to everyone. And so I think a lot of times when government gets involved in something, it is, well, here's our program, you must fit into it, instead of listening to what folks that are providing childcare need and how we can help that. And I'm most proud of that work because we increased the propensity of Black women-owned businesses who provide preschool mostly in Dayton and supported them instead of closing them down. We made sure that we had choice models across the city. So it was, Dayton Public Schools, but it might have been an employer-owned based preschool or someone that's in the block that's family-owned and family-based, but really talking about quality across all. And I think that's a key point when we're talking about early childhood learning. This is a really, really personal decision for families. And so making sure that instead of government says fit into our mold, but instead we say we want to fit into yours family, I think is really, really important. And I think that's what we've seen in Dayton as becoming a national best practice. Now look, I tell people across the country that Dayton has high quality preschool, and they're taken aback because Dayton is not a fancy town. You know, it's a gritty, resilient city. And when you have cities like Santa Barbara, California coming to Dayton to learn from us, I think that's a sign that we're doing something right, we're making a real difference. And it's because we listen to the people that are on the ground doing the work and figure out how government fits in to help them out. That's what we need to do across the state. We need to scale it. We need to have, like that's what I've called for, you know, if elected governor, 250,000 more families in early childhood learning. I know 3 to 5 is key, but frankly, I also know the first 1,000 days is really important too. We have to put focus around this. Now, I know this costs more money. I recognize that. And frankly, this governor has taken care of folks, and the state house, the illegitimate state house, has decided instead to take care of lobbyists and lawyers with their $250,000 loophole. And frankly, I just want them to pay the same amount that I'm paying or paid as mayor, you know, with my $54,000 salary. I paid Ohio income tax on that $54,000. I'd like lobbyists and lawyers to do the same. And that would help us get funding into this early childhood work. That's what we have to do, and I think it's worth it, and we have to say our kids are worth it not with our mouths, but with our money.
Thank you.
In 2020, suicide became the second leading cause of death among individuals 10 to 14 years old, and the third leading cause of death among individuals 15 to 24 years old. In 2021, Ohio's children's hospitals admitted youth to one of our inpatient behavioral health beds 10,555 times. We provided over 560,000 outpatient services in the same year. Yet it was not enough to meet the needs of Ohio's families. Kids routinely sit in emergency departments or back at home waiting desperately for sought care. If elected governor, how would you help families receive timely support and increase access to care for both preventative and crisis services?
Yeah, so this is unacceptable. It's something that's happening across the country. Ohio is not unique to this. I think last year was the first year in American history that young people's first cause of death wasn't car accidents, but was actually suicide. Now, I will also make the point that the reason why suicide deaths are so high is because children have unlimited access to guns. And frankly, every day, 65 people die at the hands of a gun, and most of them are suicides, and many of them are children. And so access to ubiquitous access on guns, and frankly, universal background checks can make a big difference in this, because then we could get guns that should never be on the street, off the street, and make a huge difference, particularly on gun access, particularly for children. And that's what we're seeing. I mean, I think particularly as we see suicide deaths, and guns are the most sure way that that suicide will be completed, rather than other sorts of attempts around suicide, so we can get to kids at that very last stage. Prevention is incredibly key. I think having more wraparound services in our schools is so important, so people can identify kids when they're having trouble before they get to that point. And making sure we have mental health providers, full mental health providers in all schools is really important. And frankly, we gotta destigmatize this. You know, a lot of this is an embarrassment, a whisper in families, a whisper between other children. And talking about it, particularly in schools and other places, and having people talk about the fact that they have mental health challenges is really, really important. You know, when the shooting happened in Dayton, and I know many of you know in 2019 we had a mass shooting in Dayton that killed 9 and injured 27 more in 32 seconds. It was terrifying and so tough on so many people, particularly in our business district. And I made the point of saying that I go see a mental health provider, a therapist regularly, because it's important that we talk about our mental health publicly, that our leaders talk about our mental health publicly, and that kids know it's okay to go get help. That doesn't mean that something is wrong with you. It is good to work on your mental health and create places of trust that you can have conversations. That is, I think, very, very important, and having wraparound services and mental health providers in our local schools would make a big difference to that. Now, we gotta fully fund what happens after they go to school, right? We can't have mental health providers in schools being like, I've got all these kids, they're having such trouble, I don't know where to go with them. And that's where this mental health funding and support of mental health long term, it can't just be, we have to have a good front door, but we have to have doors through that as well. And that's where these cuts to the bone of mental health, both for children and adults, has been really, really tough. And I have to say, we have an issue on the whole system, because you can't find a mental health provider even if you have good insurance, or if you have no insurance, it's damn near impossible. So we have to make sure that we're investing all of that in this state. This is the place, mental health and addiction services, that get cut the first, because it's the place that people don't see or don't want to talk about. That's why we have to destigmatize it, we have to talk about it, and we have to say that we want to make sure that we work with this problem instead of just sweeping it under the rug like we've done for decades.
Thank you. Unfortunately, vast disparities exist in young children's access to and the quality of the health care they receive, and the educational opportunities available to them, with outcomes predictable by race, geographical location, family income, and a myriad of other social and demographic factors. As governor, how would you promote equity and ensure that every young child in Ohio has the opportunity to achieve their full potential?
Yeah, so this is something that the state of Ohio has been fighting for decades, right? And I think it comes to what we see on unequal funding from everything from schools to human services across the state. Now look, I believe, I'm a mayor. I believe the best answers are on the ground, and we learn the best from local tacticians on what works, and then the real question is how we scale them. Well, we gotta fund them statewide. And I know I sound like a broken record here, but we can't keep on cutting taxes on the very wealthy and thinking that magically we're gonna get services to our most needed, which are our children. And so that is the work that is ahead. We have to say if our kids are what that we value, we have to fund it. And so making sure that that equity is in play for our education system is key. Now, I will say, I think the one thing the state legislature did this past biennium was actually put together a fair school funding formula. Rural districts, urban districts, and suburban districts are pretty happy for it. But again, 2 years of funding, not a long-term funding solution. So schools can't plan long enough. You have to give local governments and local practitioners a long runway so then they can put things in place and show results. This 1 year funding, make a difference, that does not work on the ground. Having long-term sustainable funding from the state and other sources, I think, is the real key answer. Because if we just kind of hodgepodge from grant year to grant year, we're not going to have sustainable investment and sustainable difference. And that's what the governor needs to focus on, and making sure that that's for real. Thank you.
We're almost done, Mayor. I have the honor of asking the last question. An integrated child-serving prevention, health, and education workforce is the foundation of support for children and families. It contributes to building a healthier, more productive, and economically vibrant state. However, the pandemic, as you know, has exposed the lack of workplace supports for key workers and created a workforce shortage across many child-serving systems. As governor, how would you address the incredible challenges that our children-serving workforce faces and ensure that those who are caring for and educating Ohio's children are set up for success going forward?
Yeah, so again, I'm really proud of the work that Preschool Promise has done on this, because we really invested in quality for all of our preschool providers, and have seen just great stories about how that's made a difference in people's lives professionally, but also better for our kids too. And so I think we need to make sure, number one, as I mentioned, directing Jobs Ohio to make this a key part where we pay attention to preschool and really invest in preschool teachers, so that way we have a portal and actually do real investment in this. But let's be honest, the government has to get involved to raise the wage for child care providers. Thank you. This is not going to be solved by a free market system. It does not work. You have to raise wages so people can get their degrees, associates, and bachelors. We say we're, counting with them on our most precious resource, but then you try to pay them $12 an hour, less than McDonald's. That's ridiculous, right? We've got to raise wage, but at the same time, we can't expect families to cover that cost. And that's where we have to enter. And getting that done for particularly families, working class families across the state, is really, really key. We can step up quality while we do that, but we've got to deal with the wage. Over and over again, that's the biggest challenge. People want to be in this profession. This profession is incredibly meaningful. It's incredibly important. I have seen story and person after person that actually cries that they have to leave early childhood education because they have to provide for their family. That's un-American. That's un-Ohioan. It's anti-woman, because this is mostly women that are doing this work, and we got to be serious about really supporting this industry. And Ohio could make a big difference to working families, working women, and working Ohio families, and say they really care about children if they actually put their money where their talk is. And that's what I intend to do as governor.
Thank you.
We're done, right?
We are done. You have any?
We are done.
Do you have any final comments you'd like to share with the?
No, I just want to say, everybody, I really appreciate the work you do. I know everybody in here, regardless of party, cares about Ohio kids. And you advocate for Ohio kids, and I appreciate that. And I hope you'll consider this race in 33 days, that we have a chance, an opportunity to do something bold and different. It's true, I look different than anybody that's ever run for governor before. And I hope you'll consider our campaign and considering really putting Ohio kids first in your vote. Thank you. Thanks. Thanks, bye.
Take care. Well, I'm wrapping it up. It's a tough act to follow with everybody that we've had here today. Help me again in thanking former Mayor Nan Whaley for spending some time with us today. So I always need to check. Can you see me over the podium? Good. Good. Oh, okay.
Excuse me. Okay, back up.
Whoops. All right, now we've got tape flying up here. We're doing great. So my name is Lisa Gray. I'm the president of Ohio Excels, and it has been great to hear from both of our gubernatorial candidates today. This is such an important issue, and the fact that we have so many of you here today and that our gubernatorial candidates saw the support for the agenda for our youngest children is just, it's going to make a huge difference for our kids. And so thank you for being with us today. I also thought we had terrific remarks and insights from our keynote speaker, Dr. Jones Harden. She was phenomenal. So it's been an incredible day, and I have learned so much more about what our families are really facing and how we can and must prevent these challenges in the future. And it's going to take all of us working together on behalf of kids and families to make this happen. So I'm confident with the coalition of incredible leaders that we have here today that we can do it. We've already accomplished so much. Getting both candidates in the room was one thing, but filling the space with advocates who we know will go out and vote on or before November 8th for policymakers who support Ohio's families and children. Because of you, the candidates are talking about the importance of our kids, and I'm calling on you now to help us hold them to it. Even though our program is coming to an end, the work is far, far from over. We have to continue to make our voices heard. Please continue to use your social media platforms to engage your own networks and to ask candidates at every chance you get about these issues. Share why investments in our young children matter to all of us. So I'm going to call a little bit of an audible here as well. Nick did this earlier. And we've heard from some really important people today, both of our gubernatorial candidates, the panel members,
but I met 3 really important people that I think need to join me on the podium. So I'm going to invite up Michelle Scott and the Ellisons. I don't know if you saw them sitting in the back of the room. How are you? You want to say hi to everybody? You want to say hi? Do you want to say hi? So they are why we are here today. This is what we get up every day to fight for. Do you want to say hi? Do you want to say something?
Want to say hi? Say hi.
Say hi.
No.
No?
Okay.
So let's be honest. It's nice to hear from the gubernatorial candidates. It's nice to hear from the people that are on the panel. But look how sweet those little ones are. And think about the possibilities ahead of them. And it's up to all, I love the peace sign. And this is what we're fighting for. And so thank you for joining me on the stage today. This little one's giving me the evil eye. She's like, we're tired, we're hungry, we just really want to go home. These little ones cannot vote, but we can vote on their behalf. So we need to make sure that the next governor of Ohio puts these kids and all Ohio kids front and center. Thank you all for lending your voices. Keep in mind the families you met on the videos today and that are sitting here with us now. And all of the experts, we need to continue to keep the pressure on, and we need to count on you all to do that. We must do better for the future of the state, and with your support and continued encouragement of our leaders, I know we can do it. So I also have the privilege, for those of you who are technically inclined, which is not me, my staff actually thinks it's funny that I'm giving away anything that has to do with technology. We had about 400 people that used the QR code, and when you did that, you were entered to win an iPad. So thank you to all of you that did that. I confirm I did not, but they told me I couldn't win the iPad, so I decided not to. So the winner of the iPad is Sheris Davis. Where's Sheris? The iPad, but I promise we're going to give it to you. You can sit. Congratulations. Congratulations. I was going to give it to myself because I've never won anything, but that's okay. If you have not yet shared your information, please do use the QR code or fill out the forms that are on the table. We also invite all of you to take a flower arrangement, but no fighting. Remember what you learned in kindergarten, okay? So we did this at an event, and I actually saw people like lunging. So please be kind. And to end this impactful day, thank you so much for coming and for standing up for Ohio's children. And on behalf of my partners at Groundwork Ohio and the Ohio Children's Hospital, Shannon Jones, Nick Lashutka, and my team at Ohio Excels, please make a plan to vote by or before November 8th. I know Nick did this earlier, but I really do want to give a special shout out to the Groundwork team. They have worked tirelessly over the last few months to make this event a success. The other thing that I want to do is to thank the staff of the Convention Center. They did a terrific job today taking care of us. So with that, thank you all for coming. Drive safely. And Sheris, I promise if you stay here, I will get you that iPad. So thank you all.
I vote for Ohio kids.
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 I vote for Ohio's kids.
I vote for Ohio 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 kids. I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.
I vote for Ohio kids.